virtual world where I am now. This is actually Borrell Island. What's going to happen then? Well, I must say I'm really happy about it, about yesterday. I really think the lounge we added some value. People went there, and as long as e-patient Dave was there talking, it was a really good place. Also yesterday at the end, we had a wrap up of the day, just sitting there in the lounge. That worked pretty well. Today we're going to up the ante a little bit by introducing Borrell Island. What's Borrell Island? Well, to borrow in Dutch, and there's a nice word for you to learn, means to have a drink with friends, some cozy snacks, and so on. So that's what we're going to do tonight. You know that normally we do a pub crawl in DevDays, the non-virtual version, and last year that worked pretty well. But this year we have set a scene on islands. I'll tell you more about that, but you can see it already a little bit here around me. So you've seen me make fun of myself, us actually in the opening movie with those boxes on our heads. You'll get your chance to do exactly the same by walking on these islands. And as long as you be pretty close to each other, you can actually talk to each other on the island. There's even a stage here. And if you stand up there, you can talk to everyone. Pretty scary, but don't worry, because everything you manage to break on an island like this, we can do everything. Oh, hold on. Oh my goodness. Look, it's all just virtual. So if I do it like this, bam, it's repaired. We can fix anything. So don't worry about it tonight. Okay, we'll have more about, see, it's flying again already. Phew, we fixed that pretty quickly. Thanks guys. All right, more about that tonight, but first some slides before we get started. Again, DevDays, of course, let me be in the right place. Here you go. One thing I keep on repeating, because this is the most frequently asked question, is can we get recordings? And yes, you can. In fact, everything that we recorded yesterday is now online. So if you go to the sessions, yesterday's session, where you had the button to actually join the session, you'll see now watch recording. Let me try this fancy stuff here. Yeah, watch recording over there. And as well, the slides have been uploaded, and you can find them. Let me step aside. Yeah, that's right. Here under documents. So we've uploaded all the slides that we have currently under this under the document link here in the menu. So you can re-enjoy, share with your friends or colleagues, whatever, what happened yesterday. Also still available today, of course, is all the ways you can get to us to get help. Most importantly, I think the virtual lounge. You have seen yesterday, there's always people from Filey there waiting for you to help you out. I do need to add, though, that we have a different Zoom link for the virtual lounge every single day. I don't know why, but that's just the case. So there is a different link from yesterday. So make sure you get the right link for the virtual lounge. Obviously, the other ways to get in contact with us are also still there. Finally, of course, just a minute for our sponsors, and just to make it easier for you to actually get to know our sponsors, we've thrown in a raffle. If you open your mobile phone, so this doesn't work on the web app for some reason, but if you have the Wova app on your mobile phone, you'll see a passport contest, and you can get stamps if you visit our sponsors. And if you have visit them all, we'll put you in a raffle, and you can win AWS vouchers. That's right. All right, so without too much further ado, because we have a lot of interesting speakers, 2 keynotes again, I'd like to introduce you to, let me step aside for his name, to Joris Leker. And Joris was involved with the development of the Dutch COVID-19 app. I guess after this whole COVID story has passed, we'll wonder why every single country built their own COVID app, but we had one in the Netherlands too. The initial version was a complete disaster, and then the government decided to do it right this way, and the second time around, and Joris is going to talk about that. So I'll pass the word to Joris.
Hi all. Let me share my screen 1 minute. So as Ewout just said, I'm going to tell you something about the Dutch COVID-19 app, an app that's basically meant to do contact tracing really well. And well, what's contact tracing? For everybody that hasn't learned yet during this pandemic, contact tracing is something health authorities do because when you've been infected with an infectious disease like COVID-19, it can take up to 2 weeks until you develop symptoms. And during that period, you probably feel pretty well. You're not aware that you've been infected. And the bad thing is that you can infect others before you feel ill yourself. And that contagious period where you can infect other people starts multiple days before you develop symptoms. And that's what contact tracing basically is about. So if you know somebody has been infected, you rush out to learn who they've met over the last couple of days when they were contagious and warn those people so they can isolate themselves and see whether they develop symptoms, maybe get them tested to make sure they have it or not, but warn people so they can't infect others and stop the spread, basically. The bad thing about contact tracing is that it takes an awful lot of time. Experience from the first COVID-19 wave in the Netherlands learned us that it can take up to 5 to 12 hours of manual labor per confirmed infection. And that work is often spread over multiple days, and it's often pretty hard to reach everybody someone has been in contact with. So a lot of manual labor and a lot of lost time, basically, in which the virus can spread freely. So that's basically the promise of digital contact tracing, or digitizing that process. Reduce the amount of labor from hours to minutes, have digital signals going out to everybody, even people that the patient doesn't remember being in touch with, or they don't even know how to reach because they don't know them. That sounds like a pretty good idea. Although I must admit that when our government first announced their plans, I guess that was somewhere at the start of April, I was pretty skeptical. It sounded like the government being tech optimistic again. They don't really have a good track record with IT. Most of their big projects seem to fail in some way. They announced insanely short timelines. We're gonna build and release this app in a month. So I was pretty skeptical. So short introduction about myself. I'm a user researcher, and I specialize I'm not a developer. I don't specialize in building stuff. I specialize in people using digital technologies and help improve them and make them as user-friendly as possible. In my daily life, I'm the founder and owner of a design studio named Valsplat, 42 years old. I live in Amsterdam, etc. But I've got quite some experience with digital technology, and I think I know something about it. Let me tell you something about how digital contact tracing works, the technical side of the story, because I guess that's relevant for the rest of my talk. If you install a contact tracing app on your phone, and the technology we implemented in the Netherlands, your phone will start transmitting random codes every 5 seconds or something like that. Other phones in your neighborhood will pick up those signals and store them. So basically, every phone that runs the app has 2 lists: the lists of codes it submitted and the list of codes it heard. And when somebody gets sick and gets ill, they will upload all the codes they send out, so everything they said, to a central server. And on the central server, nobody knows who submitted those codes, only that they belong to people that have been infected. And every couple of times a day, all the phones that have the app installed download those codes that are known to be infected and check whether they've been near them, whether they received or heard those codes in the last couple of days. And if they find a match, and they find a match with sufficient signal strength, they will warn the owner of the phone so they can isolate and give them some more advice on what to do next. So that's basically how it works. It's pretty technical, but it works, and it's privacy friendly, it's anonymous, and stuff like that. And when I found out about these inner workings of this system, I kind of thought, well, this might actually work. This might be a good way to use technology. And everybody in the Netherlands has a smartphone, so why not try it? And after that failed approach that Ewout just told us about, our government decided to do it in a totally different way. Pretty new for government. They decided they wanted to build the app themselves instead of hire big firms, big consultancies to build it for them. They decided it had to be open source, and they wanted to do it in cooperation, close cooperation with people from the digital sector in the Netherlands. And basically, they embraced all their critics and put them on the team. My role and the role of my team was to make this app super user-friendly and easy to use. We had to remove all friction from getting the app installed, using it, etc. Because from the onset, we knew the more people that use the app, the more successful and more effective it's going to be in potential. And that was quite a challenge, because I've just explained to you the inner workings of the app, but we also knew that most people wouldn't be interested in the underlying technology and wouldn't even try to understand it or get it. So even before the government invited us, we were curious what the Dutch population would think about it. So we did some research ourselves. During that first try the government to build the app, they had a webinar presenting all the ideas the market presented to them. And we recorded all those pitches by various teams and asked people in the Netherlands for feedback. And we got quite a lot. People were afraid the government was going to track and trace them. People were afraid that once they installed the app and went outside, they would get notifications all the time, maybe daily or every couple of days. And they were afraid they would become really scared to go outside. It might be a good idea right now, but they also were afraid that they could use the app to detect infected people live on the street, that it would work like something like a COVID radar. But we also had quite a good group of people that said, well, I will install this straight away, because I know, because of my health situation, I have a higher risk of seriously getting ill. And that's a misconception, because the app, it doesn't protect you in any way. It only warns you once it's too late, so you can prevent others. We had a interesting catch-22. A lot of people said, yeah, this might work, but I'll wait and see. If a lot of people install it, I might do so as well. And we had some people that really understood the concept. I want to install it because I want to prevent to unknowingly infect others. So we had some fertile ground, but a lot of misconceptions as well that were basically not very productive. So this all happened before the project even started, and we did some research during basically over a weekend. Within two days, the country being a national lockdown. So what we did, we recorded some talks, sent them out to random people, let them reflect on that, record it on their video, on their phone, send it back to us, and we listened to all those videos, analyzed all their opinions, found the commonalities, and basically that was a good start for a project, because we had a pretty good understanding combined, and those really small piece of research combined with a lot of studies from other countries and literature. We basically hit the ground running, and that's something I would like to advise to all of you. Do your research before you start building stuff, because once code is being produced, it's so hard to change your direction. A lot of studies say that it's up to 20 times as expensive, takes 20 times as much effort to get that research done up front. And do your own research, because you can learn a lot from reports and from numbers, but they only tell a part of the story. If you interview users yourselves, get to know them, really understand what they need, you will make much better projects and products. I will talk you through the three main challenges we faced, basically. First one is adoption. We know that if we didn't get this app on the phone of as many people as possible, it wouldn't work, and all our efforts to make a beautiful app would fail. So we did a lot of research into the campaign, the website, the App Store, onboarding of the app, and got a real understanding of how to sell the product, basically. What did we need to tell people to get them to install it? This is one of the first versions of the onboarding of the app. We basically used that before it was built, sketches of it, tested various iterations of it to get a feeling of the narrative, the story we needed to tell, what we needed to tell, what we didn't need to explain. And the first thing we did is basically sketch out the little comic I showed earlier, explaining the technology and explaining people that it would be safe to install the app. It wouldn't invade their privacy because it worked with anonymous codes and stuff like that, but we were completely wrong. People got really confused by that story, and it didn't really address their fears. So we switched to basically telling what the app doesn't do and very concrete examples of what it did. And it took us about 10 iterations to get there. But the one that stuck, that's the one we used for the campaigns and for the landing page, the App Store content, stuff like that. So during a couple of weeks, we tested new versions weekly. We had our designers sketch out new versions. Some of the research we did in the lab, face-to-face interviews. But because of the lockdown, most of our testing was done remote, which had some really nice upsides. Could reach people really fast and at a fraction of the cost and effort of doing that in a lab. And if face-to-face research didn't really give us clear pointers of the direction to take, or various options seemed just as good, we did some quantitative research, mostly over the weekends because we were in a hurry. So we would set up a small study, publish it, wait for a couple of days, and when we got back in the office on Monday, we would have our results and our designers could move on. So basically, this is what we ended up with for our landing page, which explains a clear why, help us spread the coronavirus, explain what the app does instead, and very tangible. You'll get notifications instead of the stuff with codes and stuff like that. And once we knew the basics were right, so we tested it a couple of times and we learned that we couldn't really improve it anymore and we were at an optimum, we started testing with a lot of different audience to basically make our design and our copy really, really foolproof. Dutch government basically promised the country that this app would be for everybody, regardless their digital literacy, their reading level, abilities and disabilities, whether you were blind, deaf, had sensomotoric disabilities, everybody should be able to use this app. Nobody should be left out. And it's something the government promises all the time, but this time we really had to do it, which was quite unique. So we focused on testing with a lot of different audiences. Elderly people weren't really digital natives. We tested the app, all the accessibility features with blind people, tested whether people with motor impairments could use it, had it translated in 11 languages, tested those localizations as well, which, because this was such a high profile project, there was a really large community in the Netherlands that were following every step we did. So we published those translations and asked people to give us feedback. So again, some learnings is that when developing products or digital products, always work outside in. Test the narrative first. Basically start your product with the packaging and your commercial slogans, your promise, and test that until people get hooked and really want your product, and then start designing your product around that promise. And do a lot of research. And that doesn't have to be big scientific studies. If you're trying to design and build a really good user-friendly product, a lot of small iterations will bring you to, will learn you a lot more than one big study. And be prepared to throw stuff away, because your first ideas are probably not the best solution. And make sure you bring in the right people. In the beginning, it's probably good to test your product with colleagues and stuff, and people that are familiar with you, but make sure you don't make it easy on yourself, and test with real challenging user groups, people that are opposed to your product, or, well, basically what we did. And the funny thing is that if you make your product user-friendly for somebody who has, for instance, a very low digital literacy, the more literate people will thank you, because it will become easier for them too. So, second critical success for our app was that we should make sure that people that got sick would use it to report a positive test. Because if nobody reports positive, then we can't warn anybody. And if we can't reach anybody, we can't warn them, then basically you're not contact tracing. So this is basically the process. You have a positive test result, you share the codes your app has sent out over the last couple of days, and others get warned. And this should only work if you have a confirmed digital test, right? You don't really want people pranking around and saying, hey, I'm positive, and a lot of people in the Netherlands receiving warnings without them having been at risk. So once somebody receives a positive test result, their identity should be verified, and the test result as well. And for that to work, we needed help of our Dutch health authorities. And the funny thing is, basically the first thing they said when we ended up at their offices is, sorry, we're not going to do this. Contact tracing is a lot of work. We're really, really busy. This will probably disturb our processes because people that receive a notification will, they're going to start calling us, and we don't want that. That doesn't fit the way we work. So that was quite harsh to find out. What we did then is we realized, wait a minute, we don't just have to convince the ordinary civilian in the Netherlands, but we have to convince those health workers as well. And we have to make a very user-friendly app or backend process for them as well, so they can support this without it taking them any or at least as little extra time as possible. So what we did is we dived into their world. We made this big map, mapping out all of their activities, their work, and we started searching for the least friction and the ideal spot to support the app. Where would it fit into that process? Something you've got to know about the COVID-19 response or health workers in the Netherlands is that it's spread out over about 30 locations in the Netherlands. It's a few thousand contact tracers working scattered over the country. A lot of them were newly onboarded, just started. So we did a lot of site visits. I guess we've been to 10 of their locations, worked alongside them for days, mapping their work, testing RDs with them, and basically ending up with the most feasible flow. And that's contact tracer calls the patient, informs them about the test result. That's till a couple of weeks ago, that was the only way you would be informed about a positive test. Then the health worker would instruct you to open the app, verify a one-time password that's shown to you in the app, read out loud by the user. And after that, you can upload your codes and they will get stamped by the health authorities and others get warned. So basically we designed, built and tested this second product, which was the portal that would support health workers. And because a lot of them were new and a lot more would be onboarded over the next months, we designed this portal with all the explanation, all the frequently asked questions that users on the phone could ask inside that portal. So it would be self-explanatory. And on top of that, of course, there was some introduction trainings as well, but that should be kept to a minimum. And I guess right now, if they call somebody, this is a flow they can do in about 3 minutes. And that's something that's acceptable at their side. We learned a lot testing this with them and with users as well. For instance, for confirming your infection, you would, as a user of the app, you would have to share your temporary password with the health authority employee, the contact tracer. So basically, this was the copy we showed in the app. Share this temporary password with the GGD employee, where the GGD is the Dutch Health Authority. Feedback we immediately got was, sorry, I will never do this. I've been instructed by government and by my bank and stuff like that to never share my password. So this is my private password. I'm not going to say that over the phone, even if they ask me. So we had to change that as well and come up with some different verbs to describe that password. So we ended up naming it a key to unlock a door through which you could upload your codes to the server. But we only found this out because we tested it. We tested the entire flow end to end with health workers, shown on the right here on the screen, and normal civilians using the app, simulating that they just got a positive test result and simulating that entire phone conversation. And for instance, the key you see here only contains characters that are easy to transmit by phone and work well in various languages. So we don't have a lot of vowels that sound similar, all to prevent errors and make it as foolproof as possible. So we designed and tested the entire flow with real users and observed what they did.
Hey, Joris, if I can get a second, we're running out of time for your presentation, so could you start ending it, please?
Yeah, sure.
Thanks.
Be aware that details can be very big. A lot of meaning is conveyed by words. So design carefully and design your copy as well. Labels and stuff, it's a skill and it will really influence how your product is used. And make sure that you involve all your users. It's a service, not a product. So last success factor, receiving a notification, just a couple of slides. If people don't change their behavior based on getting a notification and still keep spreading the virus, then we won't be able to prevent new infections. So that was the last thing we studied. Quickly found out people will freak out if they get a notification, been at risk. Our solution was, or proposal was to offer them a test, get tested as quickly as possible to reassure them. But sadly, that's not what the Dutch health authorities decided, because test capacity was very scarce at the moment we released the app. So we couldn't do that, shame. And once we launched the app, we found out another problem. We heard a lot of stories from our help desk that people would receive notifications and that it would vanish once they received it. So they would freak out because the app wouldn't tell them anything. Turned out that Apple and Google send out these nice reminders to tell you the app is active, but it really copied the Dutch localization was like, you've been exposed to COVID-19. So people really freak out. So lesson there is be aware of the context of your product. Don't just study your own product, but understand its context, all products that surround it, and be ready to adapt and respond if something is wrong. And your product is never finished. Monitor its effect, look at metrics, help desk, social media, and respond to that as well. Last slides. So how did we do? What did we do? We've been on this project for 6 months, interviewed about 200 people, thousands of response. We've got 4 million downloads now, 37,000 people that reported sick using the app, 22,000 requesting a test after receiving a notification, and almost 10 or more than 10% tested positive. And most of them hadn't been reached by contact tracers. So that's, I guess, new people we found. That's nice. And from December, you can also get a test after receiving a notification for the app. So that will be another option driver as well, which is nice. Back to you, Ewout.
All right, thanks. Thanks, Joris. It was great seeing this from the backside. Obviously, as a Dutch, I knew what was going on. I really enjoyed it. Some people asked, actually, was this so open that it was on GitHub? And actually, it was. All the work was done on GitHub, and it was especially fun to see our Secretary of State doing commits in the GitHub repo. I hadn't seen Secretary of States do that before. We've run out of time for the Q&A. We gave you a little bit more time to finish your presentation, but Joris will handle the questions at 5 in the lounge for the Q&A. So you get ample opportunity to still ask Joris questions. So I'll move over to the next presentation. Yep, thank you. Which is given by Ian from the Milton Keynes University Hospital. I've seen he's just come in, so that's nice. Andrew Torres from Cerner. And Milton Keynes University Hospital and Cerner both together with Apple implemented a solution for their patients based on Apple Health and Apple Health Kit. So without much further ado, I'll just pass the words to you because you know much better than I what has been going on there.
Hello, good morning, good afternoon, good evening, wherever you are in the world. My name is Fabbro, and together with Torres, we're going to talk to you a bit today about the project that we worked on together to integrate the Apple Health application with the Cerner electronic patient record system that we use in little old Milton Keynes Hospital here in the UK. Like I said, I'm head of IT applications at the hospital, which basically means I'm in charge of the patient record system, integration, web development, training, and a few bits either side. Drew, do you just want to give us a brief description of you and your role?
Yes, I'm Drew Torres. I'm a platform product manager in the Open Platforms Group at Cerner Corporation. And so my responsibilities include things like being responsible for our Fire APIs, our API catalog, CDS hooks, bulk Fire. And, you know, I've worked on both sides of the equation, and we'll talk about more of that later, but I am fundamentally responsible for a lot of Cerner's Fire and API-based interoperability.
Wow, that's great. So just a bit of context for you guys. Milton Keynes Hospital is considered a small to medium-sized hospital in the southeast of the UK. We are a HIMSS level 5 hospital, which means we are doing digital well, just not quite as good as the rest of them. We use heavily the Cerner electronic patient record system, Cerner Millennium, and many of the products, including the Fire API. And alongside the Cerner EPR, we also use a patient portal provided by a company, UK-based company called Zesty. And last but certainly not least, we started making our records available to our patients via the Apple Health patient portal application recently. So we got the call from Apple last year, believe it or not, after a conversation between Apple and Cerner, where simple conversation really about technical prerequisites, which of the Cerner clients had them. Milton Keynes and a few others in the UK did, and we had a call from the Apple guys in the UK to kick off the process. And from that point onwards, we worked as a joint project team between Milton Keynes Hospital IT, the Cerner guys that handled the Fire interoperability, and a core highly skilled team at Apple. I'm at this point going to ask Drew to just take us through a bit of context for this work and a few of the preceding details about what it looks like, just to give you guys a bit more information.
Yeah, thank you so much, Ian. So Cerner and Apple have been working together on this project for probably a number of years now. I think it was finally publicly available a few years ago. I think maybe 2016 or 2017, I think, is when this was first publicly available in the United States. And leading up to that, there was probably a lot of work that was put in behind the scenes leading up to that, working in secrecy and kind of facilitating, working with Apple to enable their access, to enable their development to consume Fire-based APIs that Cerner has exposed. Those APIs were developed at part of a private group called the Argonauts in the United States that was formed by a number of EHR vendors, the private sector and the public sector, to really kind of achieve and meet and develop an implementation guide that satisfies a regulatory requirement in the United States. At the time, it was the Meaningful Use Stage 3 incentive program, also the 2015 certification edition that all EHRs that are wanting to be used in healthcare fundamentally in the United States must adhere to. One of the requirements that were added as part of that certification criteria was exposing a publicly available API to enable patients to access their own health records. that recommendation came about, predating even that was the JSON task force, where Dr. McCauley from Cerner at the time was working with a number of experts in the industry to kind of understand what can improve interoperability in healthcare to kind of improve patient access. And the recommendation of that group was fundamentally that we must have an API type of approach to interoperability for EHRs and really certified health systems in the United States. And so that led to the chain of events where it was a regulatory requirement. The Argonauts got together to define an implementation guide. They agreed on a DSTU2 of the HL7 standard called FHIR, Fast Healthcare Interoperability Resources, enabling patients in a fast, web-based approach to accessing health information. And because of that great work that the industry came about, Apple was able to take advantage and really, fundamentally changing the way patients have the ability to access their health records. And so we use a number of, standards in order to enable this type of access. While FHIR is the data model, there's still a number of trust and identity proofing and identity access management pieces that enable that. And so what you're seeing here is a number of those different systems coming together fundamentally. Ian mentioned they have a patient portal using Zesty, allows for the patients to log into Zesty to actually retrieve their health information to be able to view in a web-based application. So instead of creating kind of a new identity proofing system or anything of that sort, where now the patient has to have multiple credentials, really we wanted to create a patient-first approach in how patients access these APIs. So leveraging standards like OAuth2, OpenID Connect, SAML, and FHIR really enables this interoperability and the seamless experience for patients to be able to, without any sort of frictions, securely download their health records to their personal device. So you can see here, the consumer patient will open the Apple Health app, they'll select the Milton Keynes, health system in the application, then they'll be prompted to log in. Once again, this isn't a new credential. This is just their existing username and password that they use to log into their patient portal. And they'll, have, I think, Zesty has multi-factor authentication here. So they log in their username and password, and then they get a two-factor auth code that's sent to their text message. And then they're finally presented with this screen here on the right-hand side. And so this is part of that three-legged OAuth that the SAML integration with Zesty and Cerner fundamentally enables the patient to use their credential. They're redirected to the authorization server. The authorization server then calls into services behind the scenes to ensure that the patient actually has access to records in the system to be able to construct this screen here. And so this screen is trying to create some transparency around what the patient is trying to do, somewhat of an informed consent of, do you want to allow Apple Health to access your demographics, your allergies, and your clinical data? You can click to get more details about the access that Apple's going to get. It's trying to show you to make sure you're viewing the correct information so you're not getting someone else's information. And then you can fundamentally allow access, or you could cancel to abort if you're not comfortable. And then you could also manage the applications that are accessing your APIs and accessing your data. So this screen, while from a user's perspective, is very seamless. I use my patient portal credentials, I authenticate, I authorize and consent the application to download my records, to download it to my personal device securely using very modern technologies, web-based, REST, JSON, FHIR, and OAuth. It then allows you to create that longitudinal record and longitudinal view of your personalized data. So you can see the application here is actually pulling this discrete data down to your device, and in the Apple Health app, you have the ability in the health records feature to view the different sections. You can see your conditions, you can see your lab results, you can see your medications, you can see all of the different displays here put together in a wonderful longitudinal timeline view or category views. There are a number of different ways a consumer has the ability to interact with their data in a unique way. They can view it by source, they can view it by category and dates. So you can see a continuation of that. You can see medications, and you could drill into those medications to view even additional information. What was the order taken? So you can see here on the right-hand side, the dose instructions, take one tablet, oral twice a day. You can see the early dosage range, and you could see it was prescribed by Cornelia. And so you could see all of this information and in a transparent fashion, get that data, and then really ultimately, you know, be more well engaged, well informed to understand, you know, some of the aspects of your health that you may not have known before. And so once again, really, when you talk about enabling the application and the ability to download your records, when we talk about the context of Milton Keynes, there's always three parties to this conversation to enable this application. You know, Zesty's the patient portal. That's the front door that represents Milton Keynes. That's the interaction where the patient's logging in, downloading their data. Cerner is really a platform enabler, enabling interoperability, enabling that seamless exchange of interoperable data, enabling that data liquidity to ensure that the patient always has their data available to them when they need it most. And so with that, that's in summary kind of what Cerner was here to support Milton Keynes in the relationship, in their endeavor to kind of enable that frictionless retrieval of patient information as it relates to health records feature in Apple. So I'll turn it over to Ian to continue on with the presentation.
What I want to focus on here is this idea about patient-centered care, and not just being in the center of the picture, but actually being at the center of their care. This idea of patient-centered care really came out of a national report from the 5-year forward view, or it really came to the floor at that point, and a number of different universal capabilities came out. The idea of sharing data with the patient, sharing their own records with them, was first introduced within primary care, so your own personal physicians, your own GPs, general practitioners, was the first step for the UK. But the idea of doing that within a hospital setting was still alien at that point and still quite a way off. So for Milton Keynes to be doing this with Apple Health, believe it or not, so early on, at least from a UK perspective, is quite forward thinking. Realistically, we are seeing real benefits already with the patient being activated. And what I mean by that is instead of being a recipient, a customer of care, actually they're an owner of their own care. So if I'm seeing that result at the right time, and I know for a fact that it's the right result that I'm expecting to see, and I don't need a follow-up with my physician either at the hospital or wherever, then I can cancel that and I can release time back to the hospital to go and see someone else that is in greater need. But there's all sorts of other benefits around that, and that's why I went for this very simple but quite telling image here. It really is a benefit to both sides of it. So yes, accessing your own data, real benefit for you. You get to see a whole world of information that you're not used to seeing. That level of transparency is great compared to even recent history. One of the key benefits here in the UK, our health system is so complicated, and I'm sure that's no different to anyone else outside of the UK, that actually having access to that data just makes it, even the simple logistics of going and talking to your primary care general practitioner after being to the hospital, having that data on your device to be able to show that practitioner if their system isn't yet connected up to the hospital system, just helps the patient navigate that healthcare system so much easier. The prevalence of multimorbidities, where I'm suffering from multiple different chronic diseases, means that I'm navigating across a range of different specialist teams, healthcare providers, and having access to that data and helping me navigate all of those teams just makes my experience so much quicker. Otherwise, we will pause there for questions.
Right, questions. Well, we've been monitoring the QA questions. Actually, guys, I want to ask you, Drew and Ian, to maybe after this session, take a look at the question asked in the Q&A, because I think there are quite a few interesting ones. But the main one asked was actually, this works for patients using the iOS infrastructure. How about patients using Android?
Yeah, it's a really fair question, and it's something that was asked immediately before we even went live with this functionality. So Zesty, we mentioned right at the start of the presentation, they're providing our patient portal access. And before Apple and Cerner came to us saying, hey, let's do this, we thought it would be really delivered via this Zesty patient portal. So we want to be device agnostic. We don't want to exclude half of the population of the UK. So we're still proceeding with that project, working with the guys at Zesty. They're actually called Induction Healthcare now. And we still plan to deliver all the stuff that we offer through the Apple Health app via the Zesty patient portal as well. So that's still on the roadmap. It's just taken us a little while longer to get going.
All right, thanks. As I said, there's quite a few more questions, and so I'll mention that at a 2:45, if I'm correct, in the lounge, you guys will be present to answer further questions on this. I've seen there are questions about which profiles you support and Argonaut or UK versions, all these kind of interesting things. So 2:45 is another opportunity to ask these questions. So thank you for this, Ian, especially because I know it took you quite some effort to come here today. All right, so this session is almost over. Let me just reiterate that tonight we will have the Boral. So join me please at 6 Central European time, where I'll explain a little bit more about our pub crawl tonight. And let's go for the next parallel sessions. Thanks, bye.